Hi everybody, this is Dr. Darren Smith, a board-certified plastic surgeon in New York City, and today I'm answering a very common question that I'm asked by many patients, which is if filler can sometimes migrate from the place you inject it, can fat grafts do the same thing? Now, the answer really lies in the biology of how each of those products work. They're both often used to increase the volume of a given area, and filler does it by literally filling up the empty space. So in this instance, if this represents skin and this represents fat and this space represents subcutaneous tissue or deep dermal tissue where you might be placing filler, we're literally lying in lines of filler with our injection, and this filler usually stays where you put it, but in some instances, since it's not really attached to anything, it can move around. Fat grafting, on the other hand, if we set up our same planes, here we have our muscle surface, and here we have our skin surface, when we insert our fat, we're actually doing a micro tissue transplant. So these are our little fat aliquots, which, if you zoom in even further, are really composed of tiny fat cells. And what happens is that after these fat cells are injected, blood vessels from the local tissue where we're putting the fat grows into those fat cells to keep them alive. So now we're left up with a situation where essentially the fat cells are physically attached to the recipient site tissue and integrated with it. So fat grafts do not tend to migrate like some fillers can. Thanks for watching, and please keep your questions coming. And don't forget to follow our channel.